Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
And we hope you're having a great day today. Hi, I'm Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today, our guest is Monika Otto. She is a physical therapist assistant and aquatic manager at Peak Performance Physical Therapy located in Lynbrook, right here in New York. Monika has been a part of the dynamic Peak team since her internship there, and upon graduation with honors in 2013 from the PTA program at Nassau Community College. She has specialized in aquatics as well as gait and balance and vestibular therapy, and is certified in functional movement techniques, as well as certified kinesio taping practitioner. So we're just welcoming you, Monika, here today.
Thank you so much.
So this is very interesting, and you are here. You have been here at Nassau Community College yourself.
Absolutely.
And so
where I got my degree.
Yeah, so welcome back here. Tell me about aquatic therapy. This is very interesting.
Aquatic therapy, quite honestly, is simply just getting in the water and exercising.
Okay.
It's there's different types of therapy, but overall, really, you're just going to go in the water and you're going to do exercises. It helps to speed recovery. It helps to relieve pain, often eliminating pain, and it helps to boost the process of healing. It helps to speed it up, and it's done in a fun environment that is, something that people really enjoy. Even those who are surprised that they're going to enjoy it.
Yeah. So tell me, this aquatic therapy. You have pools that patients go to experience this therapy?
Correct.
Tell us about that.
We have two offices where we have pools. One is in Lynbrook, and that is our HydroWorks 500, which is an in-ground pool with a treadmill. And that's a little larger pool. It accommodates 2 people at a time. And we're able to, it's like really cutting-edge technology, treadmills and pools, because it's really what the athletes use, pro athletes and the Olympians. It's really where it originated, was in training and rehabbing athletes. And now it has become much more popular within the therapy field. And then in our new Hyde Park office, we have the HydroWorks 300, which is a tank. And it has a door, and people can go in, and then we fill the tank level individually to a person's needs. And so that's more of a one, obviously only one person's getting in the tank, but the therapist can get in with a patient that would need it. So we have both of them, and both have treadmills and are available and more accessible. Someone's more accessible for, a large population. The pool in Lynbrook, we have a hydraulic lift chair so people can go in. I have people coming in that are non-weight bearing, but can come in wheelchairs and, partially weight bearing, and then they can get in on the chair. As long as they can transfer to the chair, we can get them in the pool. And then we also have stairs. So it's accessible by a very large population. And then the tank, they just have to be able to step up one step and get into the tank. And there's a bench in there for those that can't stand as long. So it's an excellent form of therapy.
So there's 2 locations, one in...
Right. One's in Lynbrook, New York on Merrick Road.
Right.
And that one is our main, that's like a very large office. And then we have 4 locations, but 2 with pools. The other one is in New Hyde Park, and it's on Lakeville Road and Hillside Avenue.
So tell me, with regard to, this is like a therapy. So a lot of the common layperson would probably understand and can relate to physical therapy. Mm-hmm. How does this aquatic therapy differ from the typical physical therapy?
All right. Well, typical physical therapy is done on land. And so, and obviously we're going in a pool. Now that has a lot of benefits. We keep the temperature of the pool between 90, approximately 90. Sometimes it's, a little bit less, 89. Sometimes it's a little warmer, 92. But somewhere in that range. And that's optimal for decreasing pain, for basically relaxing muscles. It promotes a healing properties by increasing circulation. So people heal faster, blood flow increases. So muscles relax, and it's an inviting environment. So people.
So the water is warm.
The water is warm, and
nice.
we keep it at a regulated temperature that's really perfect in the environment because most people will tolerate it. We have precautions with certain patients, like MS patients, that can't be in too warm a water. So this is like the ideal temperature for the vast majority of the population. And everybody comes in and they step in. They go, "Oh,
yeah,
it's great. It feels so good." And and it's great. Even working out athletes, even at a high intensity, will tolerate that temperature. Because we have everybody from 97.
Yeah, I was going to ask you, what types of patients do you see?
Everything. It's funny because yesterday I had an 87-year-old patient who came in with his daughter, and she's actually a physical therapist, not in our facility. And she didn't know what to expect. And she's been with her dad for a couple of weeks, and she's amazed. She's like, I didn't know how great this is. Mm-hmm. She loves what we do, and she's like, wow, I can see the benefit of that, and I can see the benefit of that. And then I have, I just had a child who's 7 years old. So we see just about anything you can imagine: broken bones, orthopedic injuries, joint replacements, children with back issues, neck issues. It's amazing what we see nowadays: sports injuries, ACLs. And then just we have a high gait and balance population as well. And what we can do is when you're on a treadmill, we can train you how to walk properly. For, a total knee replacement or hip replacement. You're basically in a really comfortable environment. Buoyancy is pushing up on you, so that's just the uplift of water. It helps to support people. Yeah. It gives them a greater reaction time so that where they might feel off balance and be afraid of falling on land, they're able to have time to react. Mm-hmm. But at the same time, they're working all their muscles because they're holding themselves upright. So it really is a full body workout. As opposed to just one particular. With certain exercises in therapy, we're targeting like one joint or one body part. But in aquatic therapy, we can target pretty much multiple body parts all at once. Mm-hmm.
So this can be done in conjunctive with the regular physical therapy. So you could do aquatic and the physical combined to have a better outcome. Is that ever
That's
done?
Correct. It's done all the time. It all depends. Part of the beauty of this treatment is it's very individual. We can really, and that is something that we do as our office, is we specialize the treatments specifically for a patient, what they tolerate and what their best outcome will be. So sometimes it's pool to start. Then we reintroduce land and pool. Sometimes, it depends completely on the patient and what their needs are.
You're listening to Your Family's Health at the voice of Nassau Community College, 90.3 WHPC. I'm Dr. Jeanine Cook-Garard, and today our guest is Monika Otto. We'll come right back in a few minutes.
If your skin could talk, would you listen?
As your skin, I forgive you. I forgive you for poking and popping me when I broke out at 14. I forgive you for that awful belly ring hole you left in me when you were 15. I forgive you for damaging me before prom, on spring break, and at tanning salons when you were 16, 17, 18. But I'm your skin, and if you continue to tan, I hope you can forgive me. Forgive me when wrinkles begin to show and I start developing age spots. Forgive me if I develop melanoma when you're only 22. So please, I'm asking you to stop. Stop tanning now. Our future depends on it.
Protect your skin from melanoma, the second most common cancer in young women 15 to 29 years old. And protect your future. Learn more at spotSkinCancer.org. A message from the American Academy of Dermatology.
90.3 WHPC.
We now return to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Welcome back to Your Family's Health, the voice of Nassau Community College, 90.3 WHPC. And I'm Dr. Jeanine Cook-Garard, and I'm here with our guest, Monika Otto, who's talking about aquatic therapy. Very interesting. So we ended off talking a little bit about aquatic therapy and who's really benefits, what kind of patients benefit from this therapy. Tell me about the benefits and how specifically does this benefit patients who come?
Well, first off, again, decreased pain while exercising. I think we left off when we started, we were talking about the types of patients that can go in and whether they do land. Some patients, like high pain patients, don't tolerate land therapy right away. So they come in the water, in the beginning, and they're able to, the buoyancy, as I mentioned before, is helping to lift them up so joints can move easier with less pain. The same thing with the muscles. So we're able to actually get more range of motion. We're actually able to get, less weight put on the joints because of basically we're eliminating a great amount of gravity. It depends on how deep in the water they are and their comfort level in that depth. But basically, when we get people on the treadmill, they're usually somewhere between, I would say, approximately 40 to 10% weight bearing. So basically, they've eliminated that much of gravity. So now they're weighing almost what they would weigh on the moon. And they're taking all of that pressure and all that weight off their joints. They're creating space between the joints, between the discs and the spine, and they're taking pressure off. So then you have less pain, but yet they're also able to get more range of motion. So it also, like I think I mentioned earlier, it increases blood flow. There's pressure that happens, and basically as the pressure is emanated all over the body, it helps to increase blood flow, but also reduce edema. So people with swelling, they have a lot of swelling or pain with like joint replacements. It helps to eliminate or decrease the swelling while allowing more range of motion in a more comfortable environment. So we have, it's got so many benefits. I could keep on going.
Yeah, sounds. So how does patients who, say, for example, if they had a fracture of the hip or any kind of fracture, how do they go about getting this type of therapy?
Well, they would go to their doctor, and the doctor would give them a prescription, and then they would come in and get evaluated, and the physical therapist that evaluates them would then decide what's the best course of therapy. So for someone in that situation, when it was safe for them to go in, which can happen fairly early on for someone because they can be non-weight bearing or partial weight bearing when they come in, we would get them in the pool, and as long as, they don't have an open wound or an incision that's open, and the doctor would basically, we would discuss with the doctor, too, if they didn't specify aquatic therapy, we would, let them know we want to put them in the pool and, get their approval. But most doctors are aware of aquatic therapy, but not all of them. So sometimes we have patients that go, hey, I heard about this pool. Send me there. And the doctors discover us partially through the progress that their patients make and how successful they do. So we've, gained a following amongst MDs that realize that there's a lot of benefits. And then there are those that are very well aware of them and send their patients on purpose to us because they know, the benefits are so.
So I would imagine that not all healthcare providers or physicians know about the benefits of aquatic therapy. How do you get the news out, the message out to even practitioners about this therapy?
I think that really our patients probably are our best advocates. Sometimes, there are, like I said, but we have a very open communication. Our therapists, our physical therapists, and physical therapist assistants have open lines of communication with a lot of the doctors. We keep in touch about the patients. We communicate with them about the progress of patients. We have progress notes or phone calls or just sometimes emails, just quick. It depends on the patient. It depends on the situation. But we really try to keep an open line of communication going with the doctor. and assessing their progress with the doctor. And if the doctor wants to target something, it's like we'd like to keep that communication going. And then the patient is a part of that process too.
Yeah. I wonder whether has there been any research about the differences in aquatic therapy versus the typical physical therapy and its benefit outcome for patients, either together or separate. But this would be very interesting to look into, whether there is